I'm Zoe Guile, the Climate Change Program Coordinator for the Government of the Northwest Territories Department of Health and Social Services. I'm located in Yellowknife, Northwest Territories, and I'm going to be talking about our project with HealthADAPT, which is called Understanding Health Risks from Climate Change in the Northwest Territories and Building Local Capacity for Successful Adaptations. Our project aims to create a comprehensive assessment of health risks which are posed by climate change in the NWT, and this includes adaptive capacity, key vulnerabilities, and the scope and magnitude of expected impacts to health and well-being. Our assessment looks at all regions and communities across our territory. Using the results of the assessment, we'll develop a detailed Health and Social Services Department action plan and engage key stakeholders to support improved adaptation in NWT communities and in the government. Our hope is that this will help people in the NWT to be more resilient to the changes we're already seeing in our climate and to those which will inevitably occur in the future. Through completing our project, we learned some key lessons. While climate change is definitely an urgent issue, we need to be able to slow down and do robust baselining work. We also need to do planning and engagement, and that's what we work to do through our Climate Change Risk Project. We're now looking forward to taking action on what we've learned through this project and the climate change and health assessment specifically. We also encountered some challenges. We had hoped to engage more thoroughly with communities through in-person meetings, but travel is a definite challenge at this time. So we've managed to engage through some online meetings, which definitely informed our work, but we hope to continue to do more engagement in the future. Climate change and health adaptation is happening across the territory and also by the Department of Health in many ways. However, this project has allowed us to focus on climate change and health and to identify areas that need specific attention. It has also allowed us to create a bridge between health and climate, and we've also created some really successful collaborations across departments in the Government of the Northwest Territories and with other organizations and communities. Next steps for us include developing a monitoring system to continue to expand our baseline knowledge of the impacts of climate change on health, and to also start specifically planning for climate adaptation actions with communities in the territory. More next steps for us include working to integrate traditional and local knowledge into the assessment, which will give adaptation actions the best possible chance to succeed. If I was going to give some advice to other health authorities who are embarking on climate change and health work, it would be to have a very thorough list of stakeholders and to engage with them throughout the entirety of the project. Also, to work with experts and be in touch with people who have already done similar work. And I know lots of those people within the HealthADAPT group that would be happy to help. I'd also remind people that it can be emotional work and to make sure that you're checking in on each other and to remember that you're actively being part of the solution and part of making a better future where we can be resilient to climate change.